Thank you for coming to our forum regarding botulinum toxin. And I thought today we would focus on the treatment of migraine. And of course, I'll have open mic if you want to ask a question. Looks like a nice group today. So thank you for being on the call. And I will start by just reviewing some of the science of migraine and how botulinum toxin might be helping. I get a lot of questions about this. And then if you have a further question, just hit the little button and raise your hand or type the question into the chat box if you'd rather not speak. All right, let me swap where you can see the paper I want to show you. And then um, actually, let's start with the actual course. So take a look at that. If you haven't logged in or gotten to this part of the course yet, I've saved it for last. So if you haven't gotten to this part, the way the course is situated, the last module covers some hard to treat medical problems that botulinum toxin can help. And this second one is about migraines. So in here, I have a video that it shows the anatomy and it shows that is the full treatment for migraine. I hardly ever do that full treatment. Hardly ever. I did it to demonstrate it for this course, but I hardly ever do that. So first, let me cover the science, then I'll tell you how I often modify it. All right, so let's go back to the science part. Of all the papers that I have seen, this one was the most helpful to me in understanding it. the old idea behind botulinum toxin helping had to do with relaxing muscles. And then the new idea is more about affecting the ganglion. And this picture, I'll get to it. Well, actually, let me just tell you a story first. I had a woman who came to see me for migraine. And after she was better and she came back and she was following up with me, she literally started sobbing because she said, "This is so tragic because her daughter had committed suicide." People commit suicide because of migraines fairly commonly. It's just a horrible, horrible thing to have. And after hers were gone, and she was hardly ever having any, they were separated by months instead of days. She was sobbing and wishing her daughter had found me before she gave up and committed suicide. And at that time, I was primarily using Botox combined with replacing testosterone in women. Women have more migraines than men. No one's sure exactly why, but it's thought that testosterone might be protective. And of course, they can be associated with menstrual cycles, monthly cycles with drops and rises in estrogen levels. And so I heard a physician, a gynecologist lecture about using testosterone to help migraines back in 1999, 26 years ago, and used it very, very successfully to help my patients, often combined with botulinum toxin. And at that time, I thought I was relaxing muscles, and somehow that was the reason it was helping. This picture is a better, more up to date idea about what's actually going on. So when you inject the procerus muscle, it's thought that the botulinum toxin is taken up by axonal transport and winds up at the trigeminal nucleus caudalis, which is shared by the afferents coming from the meninges. And because they're, and this is a blow up view of that, because of that sharing, there's a blocking of pain signals to to the brain. So there's not the sensation of migraine. That simple. And if you look at that, well, if that's all it takes, then why, remember that picture I showed for the official FDA recommendations or the FDA approved protocol for treating migraine? You can see maybe all of that isn't needed. So what usually happens in my practice, it goes something like this. Someone comes to me because their friend told them that my treatment makes their migraines go away. Or they're, they see something online and they book an appointment. Oftentimes what happens is they show up at a Botox party and they think they're coming just for cosmetic botulinum toxin. And they tell me that they're seeing they ask me if I can help them with the migraines. And I always truthfully tell them, if you want me to treat your migraines, I'll do it, and I'll do likely less an aggressive approach. Your neck won't feel floppy, and I'll make your face look younger. But you can go see your neurologist, and if you have good insurance, it'll cost you your $20 copay. And most of them will give me a try, but not all. There's one woman that sees her neurologist for the migraines, and she comes to me, and I do a little trick to make her mouth look younger. I do the flip of the bicularis oris, and I do a gummy smile treatment, and that's all she wants from me. Her neurologist does the rest. Her budget is more limited, and she tells me that. So she just gets a very, very light treatment of the mouth. So that's the science behind it, and that is really what gave me the idea, because there's a change in parasympathetic sympathetic tone. Reading this migraine research is what gave me, and the research regarding treatment of erectile dysfunction, which is also part of our course, is what gave me the idea for Clitoxin, using botulinum toxin to improve sexual function and urinary function in women. Because if you can change the sympathetic tone in the ganglion lining the vaginal wall, that changes parasympathetic tone by way of the inferior gastric plexus, hypogastric plexus, which signals to the lateral hypothalamus to be aroused. And women who get botulinum toxin in the clitoris through a Clitoxin procedure, that's what they report. They're more easily aroused. They don't have to wait as long. They don't have to worry if they're going to be able to become aroused. It just becomes more spontaneous. Not that they're aroused all the time. They usually phrase it something like, "This must be what it feels like to be a teenage boy and just become instantly aroused when the situation's right." So that's the science behind it, and that's somewhat the way I approach it from a marketing standpoint slash business standpoint. I don't want to bill insurance anymore, but if you still take insurance, you could bill insurance for it. And I usually wind up having a very reasonable treatment by just treating. Let's go back to the course. I only treat the Proceras and the corrugators, and I get a great response. So let's talk a little bit about other ways, other places you could put it, and then I'll take any questions and we'll call it a day. Let's see, swap what you're looking at. So I'm back inside our course. By the way, if you are going through the course and you have a question, you can always post it in the comment section and I'll see it and I can answer it without you having to attend this webinar. So this is, let's see. Yep. So I'll just kind of fast forward through here. Here's the standard injection points. If I do something in addition to Proceras and the corrugators, with me it's usually injecting along. I just like to take my finger and run along the bony posterior the occiput, and when I start to leave the skull and start to be able to palpate the soft tissue of the muscle there, occipitalis and the cervical paraspinal muscles, that's where I put the injection, and another 5 units or so per injection spot. That's how I do it. So let's kind of zoom through different parts of the video and I'll show you how I'm finding it. I think the frontalis is less important. Let me go to this spot. I don't think temporalis is as important either. I'll just, okay, I'll just talk you through this. So that if you just come across, okay, this is what I'm talking about. If you come down, this is helpful, but if you just come down, feel the bony part of the skull, and when you get to you start to feel the intersection of the bone with the muscles of the neck, that this higher injection I've found to be less important. The reason I'm telling you this is if you're going to treat people and they're paying you cash, if you can do it with less, that makes you a magician. More with less, that's magic. And so this one I have found to be helpful, um, injecting the trapezius. But that's where I was looking for. If you just take your thumb and you palpate the bony occiput, and when you come to the place where you feel the intersection of the muscles of the neck with the occiput, you're there. And that would be these injections right here. And I wouldn't get too hung up on being exactly, which muscle are you in. It's okay, but basically, if you just find that intersection of muscle with bone, and you go 2, 5, 10, 15, 20, put 20 units right there, and you combine it with your Proceris and your corrugators, then you'll get a great result, usually without any of the rest of it. Trapezius, if they complain of stiffness of the neck and the trapezius hurting, then yeah, do these 15 units on each side as well. But usually that's all. Usually I just need these, occasionally these, less rarely those, and hardly ever do I inject temporalis. Okay, let's see. I'm trying to keep these under 30 minutes. Let's see if there are any questions. And if not, we'll call it a day. I thought we'd focus on migraines today. No question. So I'll give you one marketing tip and then we'll call it a day. Even though there are TV ads now talking about migraines and botulinum toxin for migraines, the people who need it the most and have tried it with their neurologist, if they've tried it with a neurologist, they usually don't like the way it looks. It droops their face and their neck literally feels floppy because they've gotten so much toxin in it. If they've considered paying cash for it, they either think it costs too much because someone's told them they need that whole protocol, or they haven't even really considered the possibility. So, like everything, I think, especially in your cosmetic practice, nothing beats having events, because if you're in a room full of 10 women who are there for a toxin party, chances are 2 of them are going to have occasional migraines. So in your little pre-spill where you talk about things you can do, when you read my how to do a Botox party part of this course, and I tell you how to go through the party, if you mention in that this part where I talk about parties, in your preamble, when you talk about what you can do, you're explaining how it works and you're group consenting everyone. If you mention that you know a way to help them with their migraines without making their neck floppy and just doing a minimal amount, someone in the room is going to want you to do that. And then they will come see you in the office. They may not even keep coming to the parties, but they'll come see you in the office. For years, I've had people who follow me around for more than a decade because I know how to treat their migraines. Those little tricks like that really add up. Next best to that is just shoot a little video where you could take that picture I just showed you, where you have the FDA. I don't care. Use a screenshot of this course, or you just grab the package. If you go to botulinum toxin or Botox and grab the package insert, or Google Botox for migraines, you'll find that diagram, or just draw it out on a piece of paper or a whiteboard and talk about it in a video. I cannot emphasize that enough. Do a little video. Don't try to be cute. It doesn't matter if you can dance, tell a joke, or show your cleavage. Just be concerned and serious about the pain and morbidity and life altering, life limiting effects of migraine. Talk about how it affects your family life, your business life. Go into what you know about how horrible it can be for people, and that you have a way of helping with that using the latest techniques by signaling to the ganglion to block the pain signals from the meninges. You say that, and they will have probably never heard it before, even from their neurologist, and they will inquire. And remember, it's going to be a high percentage of your patients, especially your female patients. And they will come see you, and then you'll be seeing them every 3 months. And I think with that, we'll call it a day. I hope that was helpful to you guys, and that you'll consider me on standby if you have any questions about your toxin practice. I love toxin. Um, I think you guys know these days I'm mostly using Xeomin, but I've used them all, and I don't really care which one you use. Just learn to use the one you have very well. Daxify is a new one that I think is going to be very helpful. And with that, we will call it a day. Hope that was helpful to you. Bye bye.